Good morning, everybody. Good morning, everybody, and welcome to AIM Impact on Your Health. AIM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AIM Impact on Your Health is heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AIM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and of course, where we do encourage you to call in to join in. Today, let's post Father's Day show. Hope you had a wonderful weekend, all you dads out there. I hope it was celebratory. Enjoyed that Open, did you not? Hated to see Dustin Johnson miss those last two putts. What a terrible way to end the day. Anyway, we're here today. We're going to open them up in a way. This is going to be a new sort of a theme. I've kept scouring the various news media to see what I'd like to bring to you. So we'll call this segment today In the News. And, of course, still open it up for you if you want to come on in here and set the agenda as you'd like to see it. If in the course of our discussion today about things in the news, you want to call in and take over the place, the number to do that, as you should know by now, is to dial us up at 412-825-6262. That's 412-825-6262. I will listen for that knock on the door, and I will let you in the store. Now, the schedule is moving along quite nicely today, folks, is part number 2 of the cataract clinic. Remember, we launched last month and learned that we can reverse cataracts. Well, right now, I hate to tell you this, but we're batting 100%. I don't think anything stays 100%, but I'll tell you what, I'll be honest with you, and I'll give you the lowdown on what happens in this particular eye protocol we're doing this week. Starts today. It's going to be a 3-day protocol for those that have retinal diseases, and it's going to be one additional day, a 4-day protocol for those who have cataracts. A couple of patients actually have them both, and so they'll be here for the full 4 days. I'll let you know how they did in each of those categories, and see if we can maintain this string. Now, we've come up with a way of dealing with cataracts that even the great one, Dr. Ed Conrad himself, has not been able to identify yet, and I'm just waiting from him to hear from him to see how, when he used our technique as I've described it, see if his results are equal to ours. There'll be more on this subject, of course, but I'm a little rather excited to see how things are going to shake out this week for the new eye protocol. Now, if those of you who wanted to become involved with this cataract treatment program as well as the retinal program, you should know that the July program is going to be held on the 20th, 21st, and 22nd. That'd be for the retinal diseases, and one additional day for those of you who want to be involved with cataract treatments. And you want to get involved on the July program because the introductory pricing that we had initially is going to go up starting in August. And if you want to be a part of this at the lesser expensive rates, give us a call. Well, either go to the website at pittsburgheyeprotocol.com or give us a call. Talk to Sister Sarah at 724-993-0500. That's 724-993-0500. She'll give you the particulars on the matter. What else? What else? What else? Okay. The vitamin C kits in and moving along quite nicely. We're getting a lot of calls from you out there. Remember, these kits were put together so that you could put a liposomal form of vitamin C into play, which was as good as the commercially prepared, but literally for pennies a dose. We had to go out and find a proper source of vitamin C, which was non-corn derived. Sister Sarah did that. Turns out that this particular form of vitamin C is citrus derived. And then you have to mix it with lecithin. But we had another problem. You wanted to make sure that the lecithin was non-soy derived, and she found a product for that too, actually sunflower derived. Mix them together, congeal them with a ultrasonic jewelry cleaner. Yes, you heard me right. And you have, at pennies a dose, 2 years worth of vitamin C, all in one fell swoop. The kits are going. Give us a call here, 724-942-3002. You can talk to Kim, who I've heard her answer a whole bunch of questions you had out there on this matter. Give us a call, 724-942-3002. Lyme's disease, the discussion last week with Dr. David Minkoff. We've got a number of calls from you out there interested in pursuing the treatment of Lyme disease. Remember, there's a number of things now. Dr. Minkoff mentioned that in his program, he starts out dealing with deficiencies, toxicities, and then he deals with immunologicals. That's probably the autoimmune component. Before he ever goes in and starts dealing with the antimicrobial approach, he is an ozone doctor. He's one of the original doctors trained by Dr. Frank Schallenberger. So to the extent that a ozone protocol that is used in this office is carried out explicitly by Dr. David Minkoff at his, should make those of you who at least have heard us talk about using ozone as the go-to antimicrobial, avoiding the use of drugs, of pharmaceuticals, of antibiotics, which has really thrown a wrinkle into this and a more of a problem than a solution. So I think it's the teaming up of the antimicrobial approach that everyone seems to recognize as a part of this treatment, but with an immunological slant to it that allows us to identify the autoimmune disease this turns into, makes this doable. Lyme disease, a very big player in western Pennsylvania. I gave you the stats a couple of weeks ago on how this has just soared and gone through the roof in terms of the number of cases that are presented. So absolutely want to be able to get on in here sooner rather than later if any tick bite happens to develop. What else? What else? What else? Okay, a visit out here in the Washington County area. For those of you who would like to go to a free eye seminar, going to be held at the Strabane Trails Village. That'll be on June 30th. That'll be at 2:30 in the afternoon. Give us a call here. Talk to Sister Sarah. She'll get you guided into where Strabane Trails Village really is by giving her a call at 724-993-0500. What else? Hey, we scheduled a Barisha tasting, and we did that on Friday with Keith Golby, and that's going to be held in July, on July 16th, right here in my office. Now, I told you right at the end of the show on Friday that we were going to be launching the disc, well, we'll call it the iDisc. We're going to be releasing the compilation of the various shows that we've done on eye disease, and we're putting it all on one disc. We've done this with the Dr. Frank Schallenberger shows, and it was quite demanded by you, by the way. Many of you are still asking for the 3 shows that we did to Dr. Frank Schallenberger that we have put on discs. But we're putting all this most recent work with eye disorders on a disc. Looks like it's going to take more than a disc, probably 2 discs, but the 2-disc set will be available for the first time for those of you who participate and come to the Barisha tasting. Now, I'm not going to launch the disc prior to that. quite honestly, it probably will take the majority of time between now and the 16th to properly, um, whatever technological things they have to do to, cut it down and make it work and put them on the disc. Anyway, we will have the original release for those who come to the Beresha tasting on the 16th at 6:30 in the evening. Give us a call if you think you'd like to come. One free set. If it's a set or if it's on one disc, I can't really tell you right now. But all of the programs, we've done quite a few on them. In fact, I can tell you, as I sat here on Friday afternoon at 4 o'clock, making the individual inserts into the shows we already have, these are the shows that are going to be on the disc. Number one, there will be the show that we did with Dr. Ed Condrat back in December 17th of 2014. He called the show The Watergate of Eye Care, having to do with the terrible problems that are developed from these eye injections that the retinal specialists continue to use. But boy, they certainly use them at the risk of creating some terrible problems. And we're going to have that show on the disc. Then we're going to have the show that we did with Dr. Todd Wiley. He's the eye doctor from Spokane, Washington, who was first to really bring to my attention that there would be a way to get tremendously good results in treating cataracts. He introduced the concept of the beamer, and we really thank him for that. Then there's a show that we did with Dr. Lisa Bowen. She is the eye doctor who evaluates all of the patients who participate in our program, both before, or rather not before, but at the beginning of the 4-day program. And then they go back to see her on day 4 of that same week to find out how well they've responded. The show we did with her, and I know that was on June 3rd, is going to be part of it too, plus the actual interviews with the participants of the program. I think makes this a go-to and a must sort of collector's item, and we will launch it and release it to those who attend the Beresha meeting. And that'll be on the 16th of July. So put a little circle on the calendar and give us a call here at 724-942-3002, and we'll be happy to save a seat for you. Also, looking in the month of July, we got Susan Smith-Jones, Dr. Vava Vavoom herself. She returns on July 1st, the first Wednesday of the month, and it is so appropriate to have her here on first Wednesday of that month. And we'll let it go at that. All right, let's take a short break. When we return, in the news, plenty in the news. How about this one for a couple of bylines? This is Men's Health Month. At least that's what they're trying to make of it. And for all intents and purposes, it's the urologists trying to win this month over. Tell you the truth, they've really failed in the past. We'll talk about men's health. We'll talk about a hospital in Sweden now has emergency services for male rape victims. Had a little difficulty getting my mind wrapped around that one. How about this one? There's now a requirement to have a vaccine for meningitis in the state of New York. And then we'll finish it off with the top 10 lies that doctors tell. Oh my goodness, do they really lie? Anyway, be right back in a moment. Good morning, ladies and gentlemen. Welcome back once again to AIM Impact on Your Health. Heard here in KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you today on a Monday morning post-holiday. It was Father's Day this past weekend. All the dads out there, hope you had an enjoyable time. We're sort of getting back into the swing of things around here, and a new segment today we're going to open up is called In the News. I keep on searching the news for health-related matters, and interestingly enough, a few pop up that I'd like to share with you, and I'll take that on today and start this new segment, new feature as maybe a go-to and continual monthly feature here on the show. If in the course of my discussion with you today on what's in the news, you want to call in and make your own news, you can do that by dialing us up at 412-825-6262. That's 412-825-6262. I'll listen for that knock on the door, and I will let you in the store. First thing in the news, and I've had about three different, one a newspaper, then another TV ad, and then another thing on the radio. And all three of them are lining up behind recognizing June as Men's Health Awareness Month. Now, I think this is a piggyback that they're trying to play off of the October, which is Women's National Breast Cancer Awareness Month. But the backdrop for the men is the issue of prostate cancer and prostate disease, which they claim is now running rampant. A little bit on the history, and I brought you the history as it was being made. Just found out, and I didn't realize it was that long ago, 2011 is when the rules changed with respect to this thing called a PSA, a prostate-specific antigen. It's a blood test routinely done and as a screening to determine whether men were showing any signs that there were cancers on board. And this came to the forefront back in 2011 because at that time, what happened was that the internal medicine, I forget the name of them, it's a federal government agency that called the Internal Medicine Committee or something to that effect, said back in 2011 that from that point forward, prostate-specific antigen testing would no longer would not even be allowed. Wouldn't be allowed any longer. And the reason that was given at the time was that because the urology community had botched this so badly, and it was clear that it was botched so badly by the urology community, that no longer would they be allowed to routinely just order a PSA, because what had happened was when a PSA test, a prostate-specific antigen, came back and the levels were elevated, this seemed to put the urological community in and spring them into action in order to, I guess, help the poor men who had elevated prostate-specific antigens. What resulted, however, and it just got to the point back in 2011 that a federal agency said, no more, you guys are not allowed to do this anymore. You have damaged, you have maimed, you have harmed way too many men under the guise that you were there to help them. Because the truth be known, the next step, once a prostate-specific antigen was done, was that they should be getting a punch biopsy of the prostate. Now that into itself is the first potential maiming and first potential problem as I saw it back then and as I reported it to you. What then of course happened was if they after getting multiple punch biopsies of the prostate, could come up with any tissue that showed it was cancer, very invasive surgeries were done. And those invasive surgeries, according to those who were doing the study back in the day, revealed that more men were being maimed and severely limited and incontinence and impotence and all sorts of issues developed. And they claim that these men would have done well enough just left alone. They would have not died of their prostate cancer because they would have died of something else, but because of all of the harm done to them from the well-intended urology community, they felt in 2011 that enough was enough, that no longer would the urological community be given carte blanche to just literally tear into this prostate issue under the guise that they were there to help. Now, it's many years later. 4 years is a lifetime in medicine for sure. And of course, what has happened now? There are cases where had PSAs been done, that could have been detected early enough, where they claim something could have been done about them. And of course, this has now led to the resurgence of the urological community saying, no more. We want to have men go back to the PSA screening of the days gone by. Now, just to put a little bit of levity in this conversation, as I now see it, they have definitely some statistics on their side to indicate that men who would have been diagnosed earlier when something could have really been done to help them, I feel is an issue that needed to come to the forefront. But on further inspection, what I also find out is that the approach that they take to prostate cancer has not changed one single bit. That given some time with this new wrinkle of Men's Health Awareness Month of June, and not having any additional tools in the arsenal, and the fervor to want to do more than likely should be done, it won't take too much longer, in my humble opinion, to get us right back where we all were in 2011, when they literally had the toys taken away from them from their sandbox. That's the way I described it back in 2011. I'm talking about the sandbox of the urologist. Had his shovel and his little bucket taken away from him back in 2011, and now they're screaming to get it back. And should they get it back? This is probably a debatable matter, but as many men as were maimed under the guise of being doctors who wanted to help, this is going to turn sour once again. And the numbers of those who benefit from these kind of interventions versus the risks posed by them, probably we'll be hearing about in another maybe year, when this new campaign to resurrect the PSA, which, by the way, I have never shirked from the responsibility from ordering a PSA. I really didn't care that in 2011 somebody said somewhere that you shouldn't order that test anymore. We've never flinched. We've never varied. We have continued to order this right on through, no matter what. Because once we're confronted with an elevated PSA, the avenues that we have to pursue, correct, and literally turn around and improve that patient is non-invasive in any way, doesn't require any potential to harm or maim these men, and up till now at least has certainly revealed close to 100% response, which I've been pretty proud of. So we didn't have to worry about having our toys taken away from us, because the sandbox we were playing in was a healthy one, and the men who needed to benefit from a non-invasive approach that didn't leave them maimed or crippled or dysfunctional because of the intervention, I believe put us in a healthy place back then, and that's never changed. So keep in mind, this is going to come up. We're in the month of June now. You're going to be hearing a lot about men's health awareness. I thought it was a very nice thing. I found out last night in the news that Robin Cole, one of the ex-Steelers, has prostate cancer that runs rampantly in his family. He's lost family members because of it, and every male member of the family has been afflicted by this, so much so that he's taken it upon himself to encourage men to get the PSA testing done. Now, I have no problem with the PA testing. What I have a problem with is the urological community that then takes that test and gets very invasive and over invasive, I guess is a better way of saying it, to the point where they cause more harm than they did good. And it'll only be a matter of time, in my opinion, before we're back to that square once again. Hey, want to comment on this one? Give us a call, 412-825-6262. That's 412-825-6262. Be happy to comment on some, additionally with you. What else in the news? Found out that in Sweden, am I right about this? In Sweden, where are you? Yeah. Stockholm, Sweden. Found out that they have offered the first emergency services literally in the world for male rape victims. Now, for the moment, it sort of caught me off guard because I'm thinking, geez, really? They're going to go to the hospital? And then it finally was revealed. These are male rape victims by other males. And that was the thing that I wasn't catching on to. So I absolutely could appreciate and understand why, because this is the male rape capital of the world. I didn't know it was that big of a problem. Sorry, I just didn't know. And as the way they explained it, they probably need emergency medical services for how frequently this particular form of assault occurs in that country. Why so? I don't know. Yet I'm firmly convinced that it was a healthy thing to do, and that hopefully that this leads to the conviction of those who do the assaulting and the assailing. And we'll just let that go at that. Caught me by surprise. Didn't quite understand it. See it now. Got it. Let's move on. Next. The New York State Assembly and Senate has passed a bill that will now require meningitis vaccines to be placed on the list of all those other school vaccines. You know, I think the number of vaccines was well into the 30s. The total number of viruses that we expose our children to over the course of the 6 years or so before they enter school was now well into the 90s, before some bit of sanity finally comes in and parents are saying, nope, we're not doing that anymore. Well, it turns out that the state of New York has determined, oh yes, you will. And they have now claimed that meningitis vaccines need to go on the list. And starting in September of 2016, that's exactly what's going to happen in the state of New York. For those who are entering 7th grade and 12th grade, those are the two places where they want you to have not either your initial or in another booster, but meningitis vaccine. This is interesting. 19 other states also have the same requirement. So now there's a total of 20. Just statistically, to put this in some sort of a context, approximately 1,000 people get this particular disease annually. And the number, as best I can tell, of people that really do die from meningitis, they claim around 15%, which would mean 150 deaths a year to meningitis. Now, I've had many of parents contact me as their children have gone off to college and have found that it was a requirement for the particular college they were entering that all those who were attending that college needed to have the vaccine. And to date, even in the state of West Virginia, which has no philosophical opt-out, as most other states do, even in West Virginia, we're able to help these parents along by me submitting a letter as a medical doctor. The board has pretty much told parents, look, get us a letter from a doctor that says your child doesn't need to have or shouldn't have any of these vaccines, and in particular now the one that we're most concerned with was the meningitis vaccine. And we're not going to ask any questions. We're just going to let you get an opt-out. And it looks as though they're just the people at the level of the universities are using a little more common sense than the people who making the laws down there in Charleston. So happy to say that that no matter what state has had this kind of a requirement, we've been able to work with them and with parents and with the students themselves to avoid not just the meningitis vaccine, but all vaccines, because they've been asking for these immunization schedules, which, of course, in the case of these kids, are either completely blank or mostly blank. And so, with that being said, when another state, like the state of New York, takes a big, powerful hand and saying this is the way things are going to go from this point forward when it comes to meningitis vaccine, well, that's a big deal. And we bring it to your attention. Don't really know how this is going to play out in Washington, whether they're going to play a hardball or not. I think, however, the state of New York has philosophical objection. So maybe this is a lot of smoke without a fire. But more on this matter as time moves on. Okay, let's do this, folks. Let's take a short break. We'll come back with more in the news. You can come on in and set the agenda if you'd like to by dialing us up at 412-825-6262. That's 412-825-6262. We'll be back in just a moment. Good morning, everybody. Welcome back to AM Impact on Your Health here in a Monday morning post-holiday version of the show. Special segment today, we're saying in the news, what have I found in the news? I'm bringing to you things that have interested me over the course of many days, sometimes weeks. They're sort of stacked up and waiting off to the side, and today was a pretty good day to bring it out. If you want to come on in here and set the agenda as you'd like to see it, you dial us up by hitting the numbers 412-825-6262. That's 412-825-6262. I'll listen for that knock on the door, and I will let you in the store. Speaking of all that, we do have a knock. Come on in the store. Hello, welcome aboard. What's on your mind?
Hi, Dr. Courtney. My wife's 53, and she is, her heart will start racing like 200. There's probably a name for it. I told her to take magnesium and go Q10 for starters. Supposed to go to the hospital tomorrow and pick up a thing where they monitor.
A Holter monitor, yes, that's a good step. So
she thinks last year you had mentioned something about she maybe needed bioidentical steroids or something, or hormones or something perhaps, and she thinks it's because of that. That's the cause, and then she has bloating and stuff on top of that.
Well, look, let's just say that any kind of tacky arrhythmia like this, the wisest thing to do is what you're already doing. You get a Holter monitor so that you can record what this particular arrhythmia is. There are certain benign arrhythmias that literally you do nothing about, and there are other ones that you do something about. So the first step will be to document exactly what arrhythmia. The two come to mind that more than likely you're going to find out that she's experiencing. One called SVT, which is a set of everything comes in 3 letters in medicine. That's supraventricular tachycardia. And that will be addressed more than likely. Met with tepid responses. Not much is done. The other one, what I would say, would be a little more involved in terms of what to do about it. That would be if she suffers from atrial fibrillation, which is another well-known arrhythmia. She's a little young in a way. You said she's 53 years old. Is that correct?
Yes.
Okay, 53, a little young for the atrial fib. But I would say in both cases, a very good basis by which to treat it, you've already started. It would be to make certain that all minerals are dealt with, and that if there are any deficiencies in minerals, that you in fact correct them. So mineral replacement therapy is a good starting point for any of these arrhythmias. I mean, remember that the wires in the heart that service the heart and that propagate impulses through the heart are not too dissimilar from the wires in the wall of your house, except in one very important difference, and that is the wires in your heart are alive and the wires in your wall are dead. They are alive. And as such, anything that's alive better have a blood supply to it, and better have the proper nutrients going to it, and better have the ability to get toxic waste products away from them. Those three are the three prongs of attack that I believe are available to us whenever something goes haywire with those wires. And so that once you have a diagnosis of what you're up against, if they, first of all, if they suggest a medication, you have a stopgap. You have a way to deal with this before meds should really even be considered, that I don't believe the conventional medical community is going to even be aware of. So find out what the diagnosis is, and then come on in so we can talk about it, because medication will be the last step, not the first.
Okay. Hey, thanks a lot, Doctor.
Good luck to you and your wife.
Goodbye.
Absolutely. Yeah, folks, these wires are alive. You need to have perfusion. I think perfusion literally means that we're going to get a cardiovascular workup. We're going to remove cardiovascular risk factors. We're going to introduce ECP, which is external counterpulsation. And now we're going to have you driving the beamer around. You're either here in my office or in your home. That's the perfusion side. Deficiencies and toxicities, well understood, I'm sure, on your part. More on this subject as time permits. Hey, got another knock on the door. Come on the store. Hello, welcome aboard. What's on your mind? Go right ahead.
Good morning, Dr. Courtney.
Hi.
I have a comment and a question.
Sure, go right ahead.
Okay, the comment is you have a fantastic show. I love it every day on Monday, Wednesdays, and Fridays.
Oh, that's nice
you
for you.
always bring such interesting information to all of us. Thank you very much. The other question I have, my husband's PSA was about 6. A month ago, he had been on PSA pills, and his doctor wanted him to have a biopsy, and he said, no, I'll take my pills and do another blood test. So he just received another blood test. We haven't had that result back yet until this week. My question to you is, if it's still high, should he or should he not have the biopsy? And if not the biopsy, what is your next alternative?
Okay, that's a very good question to ask, and maybe I should have covered it in trying to give people an idea how to manage it, but we can answer it now. Of course, anytime a PSA is above 4, and especially if there's been a jump from a previous test not done too long ago, one must consider the possibility of malignancy. Of course, there are other reasons why a PSA could be elevated like that, and you have to look at any of the various inflammatory conditions like prostatitis, epididymitis, testicular infections, things like this that could yield an elevation due to inflammatory means, and that's why a stop up with a doctor who'll try to use, you say prostate pills. I think what they are antibiotics, okay? They're going to be ways of trying to get infectious processes removed from the equation. If, in fact, that the PSA diminishes, if it goes down, That's pretty much a convincing result that says, okay, that was inflammatory, this was not a cancer, and the both of you can move on and not worry about the next step. If, however, there's no change in the PSA, you must consider this to be a malignancy. And I believe that's probably the step that puts you in a better place, because rather than doing what the conventional medical community will want to do, they must get to the next step, which is a biopsy. If there's no biopsy, there is no next step for the conventional doctor to take. They must have a tissue diagnosis. The rules of the game make that so. And so if a patient says, I'm not having a biopsy, there will be no next step from the conventional community because they're not allowed to have a next step. Why wouldn't one want a biopsy, I think, is a question that I'd love to answer, because if you puncture a cap, if these cancers are encapsulated, and they are, and I agree that the greater that these malignancies can break through their encapsulation, the greater the chance there is for metastatic spread. But if you go ahead and just drive a needle into prostate tissue and you puncture the capsule, I believe you're disseminating the very cancer that you're trying to avoid. I think the punch biopsy way of doing this is probably the critical error that's being made, and yet it is the necessary step if any conventional treatment is even going to be considered, because they must have a tissue diagnosis. I believe that's the step that one has to be very careful in allowing the conventional medical community to take, because once they get a biopsy back showing malignancy, all of their very invasive procedures get put up on the table, and that's what got them into trouble back in 2011, and I believe it's going to get them into trouble in 2015, 16, and beyond. Hope I was able to answer that question well enough for you and your husband.
Yes, but I'm still wondering, I mean, I understand what you said, but I'm wondering, you almost either have to do the biopsy or don't do anything.
Oh, no. Thank you very much for the appropriate next question. We would never, and have never, said we were doing nothing. We just said here's what you have to do. If your PSA remains elevated after an attempt to lower it by using antibiotics or anti-inflammatories of any type, then I believe you just assume this is a malignancy without ever getting to the biopsy. And once you've made that assumption, there are non-invasive, non-toxic, non-drug cancer approaches that should be able to resolve the prostate issue, at least in my experience, within a month. Now that's pretty good, wouldn't you say?
I would say so.
To me, it's a better
service, Dr. Courtney.
Pardon me, ma'am?
Do you provide that service?
Oh yeah, I would have to say that prostate has been usually pretty safe for us to assume that we're going to eradicate it close to 100% of the time within a month. That's great.
Yes, I think it is.
It is, and I'm glad that you finally draw that out of me. I should have been able to.
Thank you very much, Dr. Courtney. I mean, I'm very troubled about this, and
sure.
I know about how all the conventional doctors do. That's why I deal with, you and Kim and things that I need to get from your office. So I just trust your, your advice on what to do. Yeah,
this is going to wind up to be a disaster. They're coming back around. For 2011, they were silenced. They, meaning the urological community, when you get your toys taken away from you like that, it's pretty much a black mark on you. But they've been quiet for 5 years, and they're starting to. They're not busy anymore. They're not doing what they did, and they're coming back around, and they have no new tools. I think that was my message. They're going to handle it the same way in 2015 as they did back in 2010, which led to having their toys taken away from the very beginning. That is the raw truth, but it is the truth. And then if something new gets brought to the marketplace, I'll let you know about it. But as of this moment, there's nothing new. Everything's old. They're going to be back to the same game.
All right. Well, thank you very much, Dr. Courtney.
Enjoyed speaking to you. Thank you very much for those questions.
Okay, thank you.
Yeah, folks, this thing with the prostate is going to go sour again. And that's probably a good thing to belabor just a little bit. If the PSA remains elevated, don't worry about getting a piece of tissue that is going to be the mandatory step in the conventional model. Without that next step, the urological community is completely they're made impotent because the rules say you can't go any further. You can't suggest any therapies because doctors, you don't have a piece of tissue in order to allow you to make any decisions about what you're going to do. So the critical step in the urological community is to have a biopsy. And I believe that's a pretty big step because if you allow a needle to puncture the capsule of these lesions, you encourage dissemination and metastatic spread when in fact you shouldn't and you don't want to do that. I believe assuming that this is a cancer is a perfectly okay step because we're going to proceed to the next steps of eradication of this cancer with or without, but we don't need biopsies. We're going to make the assumption and we're going to deal with things based on that assumption. And if the outcome is a month later, you have no elevation in your PSA, it's now below 0 or close to it, you have won and you can move on without any harm coming to you. I believe you can take that to the bank. We got another knock on the door. Come on the store. Hello, welcome aboard. What's on your mind? Go right ahead.
Yes, hi, Dr. Courtney.
Hi.
I just wanted to mention, maybe for the benefit of your listeners and the woman that just called, I think I have to agree on the biopsy of a prostate, even if it is cancer. That happened with my husband, and he had an aggressive form of prostate cancer, and they told him that when they found out with a biopsy. But he did a lot of alternative treatments and everything as well as radiation, and he still really only lived 4 years because eventually it spread.
Oh boy.
So I would think if you don't, in the first place, take the biopsies, you may have a better chance, even if you do just alternative or perhaps removal, which due to his age, they did not want to remove it. And he had several opinions of that nature. So, beforehand, I think that does spread it. And even though it was contained, he had his PSA dropped while he was on some of the drug treatments. He did lots of treatments with alternatives too, and it still was never, eventually it started to spread.
Eventually claimed him, huh?
Yeah.
Well,
so I'm thinking, going back, even though, and he had his PSA was 42.
Oh, my goodness.
He had no symptoms, but it was just taken from a routine blood work.
Sure.
So he may, her husband may not want to get a biopsy regardless.
Yeah, I'm saying that's a step that
medically they always, I guess they're going to want it.
Well, there's a prevailing mentality in the mind of the public, which is, if it's a cancer, I want you to cut it out. I want you to remove it. I want you to get rid of it. And so there's a group of people out there who hear, oh, biopsy. Oh, yes, let's get a biopsy. I'm saying that's a problem. I'm saying don't just move up there and get that biopsy, because once we have that tissue in the hand, there will be, and in your husband's case, they actually didn't want to do a total prostatectomy. He may have had metastatic spread already by the time they did elaborate what the treatment plan would be, and he probably didn't qualify for surgery. Did he qualify for the surgery? Did they want to do a prostatectomy or not?
No, they didn't. They gave him options. No, they said it was contained.
Oh, it was contained. It wasn't metastatic.
But it was a high. They said it was a high grade. He had all Gleason scores of like 7, 8, 9.
Mm-hmm. That's pretty high. That's pretty high Gleason score.
And but they did get the prostate down to like 2.1, or with he had 40 localized radiation treatments.
Mm-hmm.
I mean, going back, he never wanted to get the prostate removed, but they did not recommend that. He went to two, people that were well known in that field. I think they were going by age or something, but but I think in looking back at everything, I mean, he was taking modified citrus pectin for spreading, and he had vitamin C drips, lots of them, and they did not work for him. But in looking back, I would have probably not gotten a biopsy and then had it either totally removed or just started with alternative without a biopsy.
Exactly.
Because I think that does, because they did puncture it like that. But it did not spread till 3 years later.
I was going to say, you think, or you thought that it spread 3 years later. I'm telling you, it had already spread whenever you were officially being introduced to the urological community, but no determination as to where the spread was possible at that time. But the metastatic spread obviously is what claims the life of the patient, because prostate cancer confined to the prostate claims no one. Prostate cancer that moves in a metastatic fashion to other organs, particularly liver, lung, and brain, these are the three vital structures that ultimately and usually do claim the individual. And at one point, I guess your husband had one or number one of those places involved, correct?
He had, his went to the bone marrow, like bone marrow. I guess, I think, bone marrow is what I can remember. But,
sure. I'm sure organs.
Don't have any problem at all until the 4th year, like 3 years later.
Well, we want to get this eradicated before that ever happens. Ma'am, I thank you for the advice, and I'm sorry to hear that this did not work out in your husband's case.
Okay, well, thank you.
Absolutely, my pleasure. You have on sort of another side of the equation, folks, keep that in mind. All right, we're coming around that gun lamp. We got about 5 minutes left to go. Anybody want to weigh in on any of these items before we pull up stakes and get on out of here today? The number to do that is to dial us up at 412-825-6262. That's 412-825-6262. Now, with the few minutes that we have remaining here, rather than getting into the top 10 lies that doctors tell, I thought that this may be an interesting article. Certainly caught my attention. How about this one for an alluring title? The 3 things that healthy women do before stepping into the shower. Now that conjures up some images, doesn't it really, men? And so let me tell you what the 3 things are that healthy women do before stepping into that shower. And number 1, as it turns out, is they take out their contacts. How about that? Turns out that water and contact lenses should never mix, and that includes mixing them with your tap water, because soft contact lenses are permeable. Contaminants found in water can latch onto the lens and cause serious eye infections. So you must remove, and evidently healthy women do remove, the contact lenses upon entering the shower. I didn't know that. The next, number 2 thing that healthy women do when approaching and entering the shower is they leave their problems at the door. Women can do that. How about the 3rd one? The 3rd one, and I didn't know this either, is that they brush their hair before getting their hair wet, not after getting it wet. I didn't know that either. You probably don't know you shouldn't brush wet hair. But there's something you might not have realized. Not only is hair weaker and more prone to damage when wet, but we actually tend to be rougher on it when it's wet. Water gives hair the ability to stretch more, so you don't notice the tension. And this is comments made by hairstylist Adam at the Adam Brock Salon. So, healthy women realize this, and they brush before the shower. They leave their problems at the door, and they take out their contact lenses. These are the three things that healthy women do before stepping into the shower. All right. We are right in that gun lap portion. So just a couple things I want to bring to your attention before we bid the fond adieu. Don't forget the eye seminar, free eye seminar at the Strabane Trails Village on June 30th, about a week away, folks. If you want directions in there, how to get into the place, give us a call at 724-993-0500 and talk to Sister Sarah. She'll help you in that regard. The next eye protocol coming up after this week, of course, we are in the next 5 minutes going to be starting with the second protocol that we've done on cataracts. And I'll keep you apprised when we roll around to the Friday show. I should be able to tell you how well we did this time around and whether or not we're still going to be batting at 100% or whether we're going to be some number different. And not much change from 100, I guarantee you that. For those who would like to consider the up-and-coming July program, here's the time to get in on it with plenty of advance notice. Our July program is going to be the 20th, 21st, 22nd, and 23rd. So either go to the PittsburghEyeProtocol.com website. By the way, that website links on to Dr. Condrat's Healing the Eye and Wellness Center, now located in Fort Myers, Florida. Between the two websites, you'll be able to read to your heart's content on these programs. We are, of course, the northern affiliate of the Healing and Eye and Wellness Center, and we have conducted these eye programs each and every month since July of 2013. We'll be coming up on our anniversary next month, and we'll have some celebratory things at that time. Want you to enjoy the remainder of your week. I'll be seeing you on Wednesday. Until then, this is Dr. Dennis Courtney saying so long for AM Impact on Your Health.